this tragic death. And of course, with May being Mental Health Awareness Month, it is important, maybe more than ever now, to highlight the resources available to all of you out there and to know the ways we can best support our loved ones.
And joining us right now to help unpack all of this is Ryan Guterl. He is the Director of Retreat Behavioral Health in New Haven. Ryan, thanks so much for being with us this morning.
Thank you for allowing me to join you this morning.
Ryan, so many people are shocked and saddened by this news. Well, through the sadness, what are you hoping that it brings light to? What are you hoping that people take away from this tragic news?
I think what's really important to recognize here is that depression, anxiety, mental illness in general, there's no cookie cutter way to describe it. There are millions of Americans who struggle and suffer with this on a daily basis. And so being educated, hopefully bringing more awareness to the community is something that we can all do to combat these issues.
And combating it, I feel like for years we've been talking about the same things, that I think the most important steps are the hardest steps, which are also the first steps. Recognizing that there's a problem and overcoming that uncomfortableness to talk about it. How do we help do those two things? I mean, again, these are some of the very basic first steps. How do we do it?
Sure. So number one is that if you start looking at what some of the obvious symptoms are for some people, that's step one. I think recognizing that it could be a loss of interest in daily activities, it could be suicidal thoughts, it could be hopelessness, it could be sleeping issues, eating issues. These are the more obvious things. But one of the most important things is to recognize that it looks different for everyone. And just as a brief example, I mean, you had Robin Williams who passed away in 2014, and on the surface looked like a happy guy. But for most people, it's not quite so recognizable. So that's step one. Step two is if you want to support someone with this, educating yourself. It's really hard to understand what a person's dealing with until you are fully educated yourself.
How treatments have really evolved and changed over the years. Talk a little bit more about what the treatments are right now.
Sure. So again, looking at a person's background is really important, right? On the one hand, you have the genetic predisposition for mental illness. Right? If there's a family history, knowing that is step one. Two, there could be trauma in someone's history. There could be grief. COVID is a prime example of how many people struggle with depression and anxiety from COVID. After that, obviously, is speaking to a mental health professional. That's just step number one, because you can't diagnose it yourself. You can't necessarily treat yourself. So speaking to a doctor, a mental health professional, they're the ones that are going to determine what the next course of action would be. And in conjunction with that, one of the most proven forms of treatment for depression, anxiety, and mental illness in general is a combination of therapy or different therapies along with psychotropic medication. And again, we don't jump to medication necessarily, but that is an option. And a mental health professional or doctor would be the one to give direction on that. And last but not least would be support groups, right? Not being alone. Communication is very important. Encouraging people to get help is important. Allowing people to not feel so alone on this road is really what's important.
So how do you help somebody who's a loved one when they're going through this? I feel like there's a list of do's and don'ts, and I hate to be negative. I almost feel like there's probably a longer list of don'ts, things you should not do to try to minimize what this person is going through.
Sure. I think the very most important thing is to not minimize how difficult this can be for someone. Sometimes people have a tendency to say, hey, don't worry, you'll get over this, or this is just a bump in the road, and a lot of times it's much more than that. And the person who's experiencing it has probably been experiencing it for a long period of time. So that's the don't. The do is to make sure you provide an open line of communication. If that person feels like they have the ability to share and be open, then they're more likely to do that at some point. It doesn't mean they're absolutely going to, but having that option and feeling supported, feeling that someone is just there to listen is a big part of this.
Yeah.
Well, Ryan, thanks so much. We do appreciate your time, a lot of important information. So thanks so much for being with us.
Thanks for having me, guys.
And we do want everyone at home to know that there is help available. If you or a loved one are struggling with your mental health, there is help available. Retreat Behavioral Health has a helpline. That number is on your screen, as well as the number for the National Alliance on Mental Health. Both those numbers on your screen right now. We'll just pause for a second if you want to take out your camera, take a quick picture so you have these numbers with you on your phone if you need them or you need to share them with a loved one.